Today we're going to talk about tamoxifen. It is first synthesized as oral contraceptive pill by a company called ICI that is part now of AstraZeneca. However, this contraception use has failed and the drug showed good results with treating breast cancer. The drug got the approval from FDA to treat breast cancer on 30th of December 1977. The major brand is Nolvadex the tablet. Now, let's talk about official uses or FDA-approved uses for this medicine. The specific conditions of breast cancer that tamoxifen is approved in are ductal carcinoma in situ, in short DCIS, which means that the tumor is present in the ducts between nipple and mammary glands. The treatment of this condition involves first surgery, then radiation, and lastly hormonal therapy such as our drug tamoxifen or of course anastrozole, which may be preferred in such cases. Second use is with high-risk breast cancer patients. The risk is defined by a model called Gale model, and if the patient scores 1.67%, the patient will be considered high risk to develop breast cancer in the next 5 years, and tamoxifen use is suggested. And concerning off-label uses, there are 4 major conditions. First is gynecomastia, which is a medical condition in which male breasts are larger in size more than it is normal in males. Second is infertility, either in males or females. In males, if the reason of infertility is oligospermia, which is a medical condition in which sperm count is less than normal, tamoxifen can be used, and for females tamoxifen can be used for induction of ovulation, which means it supports the ovary to produce ova which will get the sperm and baby can be formed. Third is the use in tumors such as desmoid tumors, which are non-cancerous growths in connective tissues anywhere in the body, and meningioma, which is tumor in meninges around the brain, and lastly bladder cancer. Fourth and last off-label use is to prevent postmenopausal osteoporosis. But how this drug works? The works as selective estrogen receptor modulator. So if the patient has breast cancer in which estrogen plays significant role in the growth of cancer cells, and in this case it will be called estrogen receptor positive breast cancer, our medicine tamoxifen will act on this estrogen receptor as an antagonist, which means it will bind to this receptor and hinder its action, and in result it will make estrogen unable to activate the receptor, and then cancer cells will not grow. Although this is the main action of the medicine, as we mentioned, is antiestrogenic, tamoxifen is having estrogenic effect only in bone tissue, which allowing it to be used as preventative in postmenopausal osteoporosis. But what about the drug toxicity of this medicine? We can divide the toxic actions of tamoxifen based on the dose. In toxic doses, the patient could have convulsions and breathing difficulties. But in normal doses, hot flushes, night sweats are common. Vaginal dryness and vaginal discharge are common as well. Developing uterine malignancies is rare to happen. If you like the video, hit the like button and subscribe to our channel. Finally, you will have all the resources in the description box below. This video is made for education purposes only, and it does not substitute visiting the doctor. We hope you like this video and see you next time.